Well, in case you did not know, open enrollment for Medicare opened this past Monday. So if you're a little bit behind the 8 ball, don't worry. We have someone here to help us through the entire process, and that's Misty Bolt. Good morning, Misty.
Good morning.
All right, so give me a quick background on yourself. We know you're a Medicare specialist,
Yes.
but explain what that means.
Okay, I've been doing Medicare since 2005. Started with HealthSpring, opened up the office there, moved to Humana, and then Blue Cross, and now I have my own business. I'm an independent broker, not affiliated with the government. I help Medicare recipients decide on what their benefits are.
All right. So open enrollment began on the 15th. A lot of people may think it's November, but it's actually already open now.
Yes.
So what do we need to do? What age group are we talking about? What are the steps?
Great question. Anybody that's on a Medicare plan now and would like to look at what the new options are for 2019, now till December 7th is the time to look to see if there's anything better, to see if they're, they want to make sure their doctors are covered, their prescriptions are covered. Now's the time to see if there's, what other options are going on out there.
And if someone's new to Medicare, what do they need to do?
That's a very good question.
That's the scary part.
Yeah. They don't have the deadline of December 7th. If you're new to Medicare, you have 3 months before, the month of, and 3 months after.
Okay, perfect. So if someone's new or they want to explore their options, what do we need to be looking at? Of course, I know we can give you a call and you'll help us.
Yes,
but
absolutely.
I mean, if we want to try to navigate on our own or get started, what's the key things to keep in mind?
Medicare.gov is a good place to start because all the plans are there and they're regulated by the government. And you can look at your options, and put your prescriptions in, and it can tell you a plan that's available. I have 23 agents that can help, and we're at 3 Walmart stores this year too.
All right, so you're very conveniently located.
Yes.
So the big question, how much is it going to cost me and what am I going to get?
Yes, very good question. And there's several plans out there. Some have premiums and some have no premiums. So we can go through all that and see what best fits them based on their needs and their health needs, and we'll be glad to do that for them.
And the cost is going to be dependent on what coverage you need, right?
Exactly.
But overall, you're going to make it work for us.
Yeah.
Find the best option. If we have a budget, you're going to help us find the best coverage for that budget.
Exactly.
That's the big thing is Medicare can be confusing. There's different options.
Very.
But at the same time, it's really possible to find a solution that best fits each individual.
Yes.
How do you go through the process with a client? What do you look at? What are your key items?
The first thing, they have a stack of mail, and they're like, I don't know where to start, and it's very confusing. When I first started, I thought the same thing, I'm never going to learn this. So I go and find out, what they're looking for, what their wants are, what their needs are, and I try to fit that all together into one plan to see what best fits them.
I'm not even close to Medicare age, and it scares me. So
well, maybe I'll be around.
I hope so, because I know I will need you. So what is the first thing to get started? I mean, if someone is currently a Medicare patient or they're new to Medicare, what's step one?
Step one, they have to have Part B, Medicare Part B. Part A is what we pay taxes on while we're working. Part B is what we pay a premium on when we retire and we get on Medicare. So they want to make sure that their Medicare Part B is active if they're not working, and have employer coverage. And then once they have Part B, I go to the process on what options are available for them.
All right, perfect. So what age range do you typically work with, or is it open to about everybody?
On Medicare, it's 65 and above, but if they're disabled, they can be 18, on above.
Because that's a whole different category.
It is, yeah.
Okay, Misty, how do we get in touch with you? How do we get started with you helping us find the best fit?
Okay, my phone number is 423-240-0794, and they can call that, leave me a message. They can look at my website, MedicareMisty.com, and that will give them more information too. They can email me if they'd like to at MedicareMisty@gmail.com. So email, phone call me, and then I can or they can stop by the local Walmart, Hickson, Signal Mountain, and Shallowford and Moore Road.
Perfect. You said you have over 20 agents that are helping you out, and
Yes.
again, we want to note that you are an independent agent, so you're really working for us then.
I am.
All right, perfect. Thanks so much, Misty, for joining us. If you have any questions or if you want to make sure that your current plan is the best plan for you, then go ahead and give Misty a call. She's here to help. Again, the open enrollment window started this October 15th, a Monday or so ago, and it's going to run through December 7th.